Tanya is a senior medical social scientist with specialisms in anthropology, sociology, and psychology, having received her PhD from the University of Chicago in 1997. She's originally from Canada and now has lived in and worked in Ireland for most of her adult life. Her current research focuses on the global story of bodily generosity, in particular the exchange of human milk, including donation following perinatal bereavement. Tanya has studied these topics in European and global contexts and has been awarded numerous prestigious research awards, including an EU Horizon 2020 award and a Fulbright award, where she travelled to MIT and studied mothers who had donated to one of the first human milk services, donor human milk services in the world in Boston in 1910. She's also received an award from DCU's President's Research Impact Award in May of this year. And she's an author of a book called Banking on Milk, an ethnography of donor human milk relations, which is available online. It's an open access book. She's the ethics advisor to the UK Association of Milk Banking and a member of the Scientific Advisory Board, and also a member of the European Milk Banking Association Board. In addition, she's been a member of the British Association of Perinatal Medicine Working Group, which was led by Dr. Cora Doherty, which produced a report on lactation and loss in May of this year. And both of these topics she's going to discuss further now. So thank you, Tanya, and we look forward to hearing more about your work.
Thank you, and Denise, very much for inviting me here today and for putting this topic on today's discussion. As we've all been talking today and for the week about the National Breastfeeding Week, it is also October marks Pregnancy and Infant Loss Awareness Month around the world. And so this is a topic that many people are thinking about as well during this month. This time last year, we were separated in terms of thinking about these things. You guys gave your wonderful webinar on breastfeeding. And at the end of the month, I coordinated, again with Justin's help, another webinar specifically about lactation and loss. So what I wanted to do today, after talking to Gillian about broadly what I could do, I've been working in this area for a long time, and so I could talk for a long time. We've all been here for quite a while, and I'm going to instead try to take the next 20 minutes and quickly go through a variety of things that I have not mentioned in previous things. I will point people to other things that they can look at, because this is a topic that's increasingly growing in terms of the discussion about it. That is important and something I've seen happen in the last 17 years. So I think that's wonderful. So I've organized this around these components in terms of thinking about Ireland, thinking internationally as a culturally orientated social scientist. I always want to think internationally, but I've also been trying to give you some practical information because I'm a social scientist. I often think in terms of research, but I want to point you to directions where you can look for further information for yourself. And I appreciate the previous speakers did similar things for you as well. So I'm hoping that. I also wanted to point to some things that are happening now and go back to discussions about Ireland. So the first thing I wanted us to look at were some recent statistics from the CSO. And I just wanted to remind us what it is we're talking about in terms of thinking about this. These figures are from the first quarter of 2022. And so in that quarter, they let us know that we had 43 infant deaths. By definition, infant deaths include any infant under the age of 1. And we had during that same period 34 neonatal deaths. And neonatal deaths are defined as less than a month old, and they include preterm, but also stillbirths. So there, in that first quarter, there's not a huge amount, but we are talking about about mothers and families that are affiliated with each of these. And I also put what this related to for 2021. So over that year, we had 180 infant deaths. And out of that, there were 140 neonatal deaths. So the majority are in fact neonatal deaths that occur at this time. Many of those deaths are related to preterm birth, and this is why I partially became very interested in this topic, because of the fact that I've worked on preterm birth. And the issue about thinking about lactation and loss is something that people who work in the world of preterm birth are very familiar with, because it becomes part of their care. However, this is something that I think it was Sharon Brewer from Wales recently mentioned, and I'll show you her podcast that she discussed about this. She mentioned she's been working in this much longer than myself as well, and she mentioned that 30 years ago, part of reproductive care involved a recognition of changes around your breasts, including a physical exam about breasts, reminding people that lactation is part of the reproductive components, and that whether the baby is there or not, that is part of what's going to happen to people's bodies. So there we go. Just 1 second. It's not going forward. Let's see if we can make it. Okay. In terms of some other statistics, I put some from Europe to sort of remind us where we are in terms of this. We have lower than EU average rates for infant mortality. This was not always the case. We did historically have very high rates compared to some parts of Europe, but it depended on which parts of Europe we were comparing these. There is also research that argues that in Ireland, and someone asked about rates for different parts of the country about breastfeeding, we can also look at rates for infant mortality based on different parts of the country and where this occurs. There are disproportionate rates in terms of socioeconomic inequity, and that becomes an important point. The other characteristic about this is that generally across Europe and across Ireland as well, we've seen huge reductions in the last 30, 40, 50 years. And those reductions are things we should all be proud of. But as I said before, we still have over 100 families going through this each year here in Ireland. And this is an important component that we need to remember and think about. In terms of thinking about research associated with this, so often the research is, in terms of this, is tied to larger questions about thinking about some of these components. And we've seen recently more research coming out. One of these is from my colleague, Aliad Orag. She's actually in Israel now, but she completed her PhD in 2019 on this topic in the US. And she, before completing her PhD, actually published a conversation piece about this, which was important for us to discuss. It's not the first time that people have been discussing this, and it's not the only place. I mentioned these seminar that we put together last November. This is the number of people who presented at that webinar that we had last year. And as you can see, we have colleagues from Australia. Catherine Carroll's work goes back to 2013, and she was in the US, but now she's back in Australia and has been working on these things. We also have colleagues from Vietnam who we asked to present at the conference last year, and their discussion is online as well and is available for you. But also I'm going to mention more. The memory milk gift was just beginning. It was about 6 months old at that point, and now has developed even more. And my colleague from Israel and my colleague from the US, Dr. Naomi Bar-Yam, both talking. Naomi is probably one of the early people who have also talked about this. We could have also asked Denise to come and talk. She's done work on this as well in Ireland, but I'll mention that in 1 minute as well. I just wanted to show this briefly, that Catherine back in 2013 had also a conversation piece. The advantages to these conversation pieces are that people talk about these things. And historically, we would argue there are cross-culturally and historically, researchers argue that there was a difference when we had very high rates of infant mortality, that people distanced themselves emotionally, and therefore we did not think about this. More recent research has argued that that was a public presentation, and that a private presentation was still very emotional on the part of mothers in particular, but also families involved in these components. And that private sense of grief is a complex issue that needs to be recognized. So in terms of thinking about these things, some of the earlier work that was associated with it became integrated with donor human milk. As Gillian pointed out, I have worked in that area. It's an area that is related to preterm birth when a mother is not able to actually produce milk herself. The increasing global argument for evidence is to use, at least as a bridge to breastfeeding for mother's own milk, donor human milk. In those cases, however, we have rates and cases where mothers, infants, unfortunately don't make it. And we have often had discussions about mothers in a number of circumstances. For instance, mothers who have expressed while their babies were in units, and then if those babies passed, they have milk in either frozen or components like that. And that's one type of person who then needs support and advice about what to do. There is then also other mothers who then choose potentially to continue to express after the death of their infant. And there are some mothers who have expressed after the death of an infant and have not expressed beforehand. So a number of these were part of discussions from, this is a picture from the North American Milk Banking Association, who for the longest time was the main discussion of things. This was originally based on Wellborn's work from 2012, which was her PhD. But it meant for a long time we did not have additional information. We then, however, started to see an influx of more and more information slowly trickling forward. And in 2019, there was a global group, again, connected to milk banking, that highlighted this as an important issue and have made available freely online for the global community guidance for engaging with bereaved mothers. These include templates for various policies and pamphlets that can be used, and that those were made, can be edited and monitored for people. I wanted to show a couple of the things that we used when we were thinking and writing that particular document. And one of the things we did was to look at pamphlets around the world. And this is one from the New York Milk Bank, which is actually quite interesting and helpful. I'll just quickly go over it for you. They give resources thinking about things, but they also present this in terms of reminding people that there are people here who are thinking about this. They give the same classification that I mentioned in terms of different potential mothers who might be interested in finding these things. I've also included one which was put together based on Denise's work, her master's work on this topic. We in Ireland have had a long, important contribution to this topic. I think I've actually argued that it's partially cultural, that we think and talk about death potentially more than some other parts of the UK. And so we should present these things, and we have in the past presented them. These pamphlets are openly available online for anyone who wants to extend more information. Another one is from Our Lady, the Crumlin Hospital, where of course this is a different issue in terms of thinking about some of these things, but the advice and pamphlet is very similar, and they present this again with Joanne's discussion there about her work or her donations following Olivia's death. She's actually written about this and is part of some of the work that we're doing now. I'm aware that there's not as much time to go through all of these things. I want to very quickly mention some of the research that we've done, which much of it is included in Banking on Milk, but other parts of it are going to be included in a special issue of the maternal and child nutrition that we're doing right now, that Gillian mentioned at the beginning, that's hopefully going to be out in the next few months. But that these were based on thinking about this from the beginning to the end, and in between. So thinking about preterm birth and providing potential human milk when mother's own milk is not available was a key component. And we ended up in the middle of it going to an important bereavement and midwifery care conference that was held in Edinburgh in December 2016, when SANS gave their new booklet. And it was important because it included discussions about milk donation and stored milk for the first time. Our research showed that at that time we had the 4 milk banks that we were involved with that I showed you earlier, and Ireland's rate was huge compared to the others. It's ended up being that many of the rates for what is now called the Chester Milk Bank, they have changed their name, are much higher because of them being involved in the Memory Milk Project and being involved in the research that we did for the Banking on Milk project. In that project, we talked about some of the components from different people that I spoke to and some of their rationales and reasonings. We talked about not only the different kinds of donors that may be there, but also thinking about recipients and who might receive human milk after an infant has died, and also how this affects staff and characteristics of that. Finally, I want to ever so quickly talk about the BAPM report that I was involved with. The BAPM report is wonderful. We had, again, another webinar, and on that, I would recommend you going to the School of Nursing, Psychotherapy, and Community Health YouTube page. All of the lectures that we gave in May on this are there, including Dr. Cora Daugherty's, who led the BAPM's group. Her presentation is there, and she goes through this in much greater detail. She is herself a physician and a clinician, and she gives an awful lot of wonderful information about the report. The report is wonderful that it exists because it means we're actually talking about these things, and it is part of what clinical considerations. Briefly, one of the things that as a cultural researcher, I was very proud that we came up with as a team was the acronym FOREVER, and the characteristics of thinking about the growing of knowledge and characteristics of thinking about life continuing even after death. And FOREVER has all of these components that you can go through yourself and look at and think about. But the most important things are remembering that there are families involved, that to have open discussions, to listen. These are important components because grief, maternal grief, as any of us who have worked in this area know, is very complex. And therefore, it is very important to think about each of these components, explain options, explore things. We've heard other speakers talk about the importance of listening and being empathetic, but we've included all of those in this as well, and respect and reviewing as the last component in terms of thinking of that. So let me see. It's not going there. Okay, hold on.
Just click on the slide itself, Tanya. No.
So I'm finishing up now. This is the tree from the Memory Milk Project, which is housed at the Chester Milk Bank. These trees, we see trees all over the world. We're actually writing a paper right now about the trees and the symbolism of trees. Whether they include butterflies or not, from a social scientist perspective, is very important. But I think it's very important in terms of the Memory Milk Project to remember that characteristics and components like this are important to families involved. They end up having a place that is recognized in terms of their infants' early demise, sometimes even later demise. And in addition, I mentioned I mentioned Sharon Brewer earlier. This podcast actually was linked to the Memory Milk Project, and Nick Embleton also gave a discussion, who has this amazing butterfly project that they've worked together, which involves when a twin passes away and there's one child remaining, it lets staff know that there's been a loss of a twin when they put a butterfly on the unit, on the infant's crib. And in terms of the podcast, there are some wonderful things there that can be helpful for you. And once again, Laura Atherton talks about some of the work that the Memory Milk Gift has done. They are spreading throughout the UK. We have been working together with them to bring some of these components to Ireland, certainly through Northern Ireland, but then recognizing that the human milk services are an all Ireland component, and that we as an island often want to think about these things, especially working together. We have two different health systems, but we can certainly help each other and work together about these things. I put, this is from Sharon's discussion about the different component or stages in terms of lactogenesis. We talk about this in the BAPM report, but I think this is a better picture than the one, and had we actually had it, I would have liked to have put it in the report. So finally, I wanted to just mention some of the things that some of my other colleagues would be aware of. The HICA, so the standards for thinking about some of the care and research evidence in Ireland, is currently running a survey on that they've talked about in terms of the national maternity bereavement experience. This survey is actually open still until the end of the month. It can be found at yourexperience.ie. They have one question about lactation, whether you received information or support. And that one question I thought was relevant in terms of thinking about this. I am not sure that doing a survey was the best way to methodologically approach this topic, but it's still going to be done. And they did get lots of evidence support from parents and families who have gone through bereavement. And I read the survey before they actually did it. So I think it is important to do this rather than not do it, but we could see other information. Finally, I just wanted to remind people, as I mentioned before, this is the Pregnancy and Infant Loss Month. And on October 15th, there is a World Day that is called the International Wave of Light, where around the world and often online, people light a candle in memory of all of the infants who have passed away. And I just wanted to remind us all that we can do that at 7 o'clock our time. And it ends up being that they start a wave of light across the world. So that's why we do it at that time, so that it moves around. So it's the local time that we think of in terms of these things. The ultimate characteristics in terms of thinking about bereavement and lactation is to remember that this is something we should talk about. It is not talking about death. We've had loads of people say, oh, I didn't want to say the wrong thing. But we've heard from bereaved families that the one thing that is a problem is when people don't say anything. You can never make it worse because it's already as bad as it's going to be. So, okay, thank you.